The Union Cabinet has given a green light to a health coverage of rupees 5 lakh for all senior citizens aged 70 and above under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. This decision, announced yesterday, is set to provide relief to millions across India, benefiting an estimated 45 million families. Union Minister of Information and Broadcasting Ashwini Vaishnaw called the move a step towards creating an inclusive healthcare system in India. Further, the government also clarified that all senior citizens of age 70 years and above, irrespective of their socio-economic status, would be eligible to avail the benefits of the scheme. The announcement has sparked reactions across the healthcare and legal sectors, with professionals commending the move and saying that this would fill a critical gap in India's healthcare ecosystem and would be extremely beneficial in ensuring that senior citizens, who currently make up about 10.5% of the country's population, are not left without support during their most vulnerable time. So, who all can benefit from the scheme? Well, the government has clarified that all senior citizens aged 70 and above who belong to families already covered under the APM Yojana will be eligible for an additional top-up cover of rupees 5 lakh per year. This means families can share this coverage between their senior members. Those benefiting from other public health insurance schemes such as the Central Government Health Scheme, the CGHS, Ex-Servicemen Contribution Health Scheme, or the Ayushman Central Armed Police Force Scheme may either stick to their current scheme or opt for the new benefits. Additionally, senior citizens under private health insurance policies or the Employees State Insurance Scheme will also be eligible for this expanded coverage. We'll talk about this and try and understand what this means for the senior citizens who are covered and the healthcare ecosystem as a whole. Dr. Sanjeev Bagai, Chairman of Nephron, Padma Shri, with us on the broadcast. Dr. PSV Rao, Consultant Surgeon, Manipal Hospital from Bangalore, is also here with us. Dr. Sharat Kohli, Senior Economist, joins us on the program as well. Last but by no means the least, Mr. Sandeep Chatra, Executive Director of Action Aid Association India, also joins us on the broadcast. Dr. Bagai, your reaction to this scheme, very much needed, or do you think the scope is so large that perhaps the challenges are not being envisaged at this point in time?
Good evening everyone. I think this is a correct move. It's a strong move. Yes, there may be a little bit of a teething problem during the implementation, but the best step forward is to take a step forward. When you look at an age group of beyond 70, which is the senior citizen group, the geriatric group, there are 5 major illnesses which generally affect cancers, respiratory ailments, cardiac ailments, neurological events like stroke, Alzheimer's, dementias, and last and not the least is the bone and metabolic, diabetes and other things. 61% of the overall disease burden in India is non-communicable diseases. That means lifestyle-related diseases. This is something which is going to give a great impetus to support the families, because chronic ailments, that is chronic liver disease, chronic kidney disease, or cardiac ailments, is a huge cost burden, ongoing month on month. Even if you get a surgery done, the ongoing cost month on month post recovery is quite a bit. And I think this is a huge step forward. Full compliments to the government. I would also like this to people to understand that the initial Ayushman Bharat has covered more than 55 crores. It's 3 to 4 times the population of many countries of Europe itself, out of which 50% beneficiaries are Indians. So this is a good move. It's the largest health insurance scheme, and it would become even larger. Good move, strong move. They will require a little bit of coordination on the ground, but it's a great step forward. Over to you.
It's a great step forward. Dr. Kohli, what do you make of this step, and how is this likely to basically, for the lack of a better word, improve the healthcare system, which has been found wanting when it comes to healthcare of senior citizens, and also, make healthcare accessible to those people who can't afford, something like this otherwise?
Good evening, Vineet. Good evening to my fellow panelists and NewsX viewers. If we look at the numbers, you said 10% of the people in India are senior citizens. If we look at the numbers, we take about 14 to 15 crores. The total number of senior citizens. Out of that, people who are over 70. In my estimate, about 6 to 7 crores. If half of that population is over 70, and probably the other half of the population is between 60 and 70. So those are the numbers that we are looking at. One. Two, I would like to divide these senior citizens over 70 into three categories. There is one category which are the most vulnerable. That is, they are either below the poverty line or in the poorer category. The second category is the middle class who stay alone, who do not stay with their children, and they do not, probably either they have a pension or they have some kind of monthly income coming, but they are on their own. People who might like to go to old age homes and so on and so forth. That's that. Then the third category is the affluent category, where they have their children or they have their savings in place. They have a lot of money. There's no dearth. So I think the first two that I spoke of are the ones who are going to basically benefit out of this. And 5 lakh rupees, although I have two doctors on the panel, one admission to the hospital at that age, it can just go on to any limit. Depends on what kind of medical health care you need. Whether you're going for a heart transplant, you're going for a kidney trouble, or you're going for a knee transplant. But I think 5 lakhs amount has been kept as a benchmark where most of your basic surgeries, basic treatment does get covered. Only in exceptional cases, I think the doctors on the panel would agree with me that only in exceptional cases your medical bill crosses that limit in one particular, unless of course somebody is chronically ill or somebody has got a very, very severe ailment. So I think it basically addresses all the medical problems of a normally ill person over 70, kind of ailments that you get. You're suffering from diabetes, you're suffering from high blood pressure, you're suffering from hypertension, you've got a minor heart ailment, you've got some treatment going on for your calcium bones here and there, arthritis and things like that. So I think it principally covers a huge relief. As I said, Vineet, for the two categories that I mentioned, I would like to reiterate. One is the poorer people, people who just about survive at their age. The second class is the people who stay on their own and they've got some kind of fixed income, but the income is just about enough to help them survive. But if there is a major expenditure, they are caught on the wrong foot. They do not have money to spend. I think for them, this will be a huge relief covering. We all know, more than 50 crore people, as Dr. Bagai said, have been benefited by it. So a test run of Ayushman Bharat across the population has already been done. There were some troubles here and there. There were hospitals, not approving. There were hospitals not admitting patients. There were certain bills, with insurance companies not getting cleared. Those problems remain in the system. So I think we are expanding that scheme. I would say we are taking that scheme to the next dimension now. So I think the government will have to, or rather the health ministry will have to address these problems, because these people will not be able to run from pillar to post. Remember, if there was a 35-year-old or a 45-year-old having problem with Ayushman Bharat, he could afford to run around. But you cannot expect a 75-year-old man or a woman to be running around to make sure that he's admitted properly. So I think a special kind of instructions or a special kind of guidelines will have to be given to the hospitals, to whosoever is eligible, whichever medical institutions, the insurance companies, any part of that system will have to be alerted that, look, whatever you've been doing to Ayushman Bharat, whatever problem that people have faced with Ayushman Bharat, with that card which you get made, I think need to be addressed comprehensively. Otherwise, as rightly said, implementation down the line would be a bit of a challenge, because this is, and of course, the big problem we need, why forget the states, the political differences, the states which obstruct implementation of Ayushman Bharat. For example, Delhi, they do not allow Ayushman Bharat to work. So I think those states will also have to be taking care, because there are schemes of central government which are landing into state subjects and the states are not allowing. So I'm sure the government had set its vision, and I'm sure the government has thought about these problems, and we will see as it progresses, Vineet, in the weeks to come.
Mr. Chachra, healthcare inclusivity, does it begin with a move like this? Or do you think that there are problems which perhaps might be addressed because of this, but there are also hundreds of other problems when it comes to healthcare, that ought to be discussed along with this provision, which is very good, and the government should be commended for that.
I'll touch on that. And thank you for having me here, Vinitji, and greetings to my co-panelists and all the NewsX viewers. And I'll continue from where Dr. Bagai and Dr. Kohli left off. So I welcome this scheme. We welcome this scheme, and I'll tell you why. We welcome it because it's universal. We welcome it because it's for all. And I'll tell you why. Because we know that within whatever categories, social classes Dr. Kohli was speaking to, the middle class, the working class, and the richer ones, within that, old age people do not have the autonomy, 70 plus especially, and are often dependent. And often we know of these stories, and often totally dependent on their children and on the good-heartedness of their children. We hope it continues, but it's not always the case. So I think this offers that autonomy because it covers everybody, irrespective of where they are, whether they are poor, whether they are middle class, whether they are working class, or whether they are rich. And I think I welcome it for that universality. I welcome it for the universality also because there are n number of studies, Dr. Kohli must be knowing about it as well, which tell us that universal public services, free, quality, universal public services, social security services, universal healthcare services are always in the long run deliver higher quality because of the different classes involved and have much greater democratic scrutiny. We have this longitudinal research available in several countries of the world. So I welcome it from the universality, for its universality from that standpoint. Now we must caution, and I'll come to some of the issues that you were asking to. We have been cautioned by various experts into, the question that insurance-based pathways generally sort of end up and lead to. We must be cautioned. Experts has cautioned us on that. You know what happens? And ultimately, insurance-based pathways take away in the attention, public attention, but also in the state funding from what is called investments into public health infrastructure. What insurance-based pathways end up ultimately is and by widening the base into private healthcare providers, private healthcare infrastructure, private healthcare insurers, and so on and so forth. So ultimately, it ends up benefiting much more private health systems. And we have the Ayushman Bharat sort of a continued scheme examples to talk of. We can look at data there, and I think that needs to be, that trajectory needs to be cautioned and turned because ultimately we do want the public healthcare system, the public healthcare infrastructure, the curative, it's not just the curative, the primary and the preventive healthcare system to be strengthened in our country. Our spending on health is less than 1.5% of the GDP. We need to take it much, we need to see a much bigger role there of the public healthcare spending. And I think that whole arena is a concern. And then there are the implementation problems, which Dr. Kohli spoke to. There are issues which, the very bad reimbursement rates are deterring even private healthcare providers to admit patients. So I think that needs to be addressed. And like he said, 70 plus year old people can't be running around for billings, can't be running around for clearances, can't be waiting for reimbursements to come. There are also problems of overbilling and fraud, which have come out. And I think this needs to be handled. And ultimately, we also need to make sure that we are investing more and more on preventive healthcare. Lifestyle was talked to by Dr. Bagai in the beginning, much more on the preventive healthcare, much more on what is called the primary public healthcare infrastructure, which is where the large majority of India sort of goes to. And we see significant diversity, what is called diversity is there, if I may use it. There are inadequacies between the rural and the urban. We see all kind of, sort of disparities there. Although I must also say that some recent studies, like the one conducted by Dr. Dres, Dr. Sean Dres, Ritika Khera, and Mr. Malhotra, tells us that contrary to public opinion, if you look from 2002 to now, public healthcare infrastructure, primary healthcare infrastructure has shown some signs of improvement. They have studied 5 states, Jharkhand, Chhattisgarh, Bihar, Rajasthan and Himachal Pradesh, and these were the states they studied in 2002 as well. So it has shown signs of improvement. There's a path to go on, but I think that happens. One last point I'd like to make with reference to the age at 70. You see, morbidity, health is a function ultimately of nutrition, is a function ultimately on how you spent your life, the 70 years before of your life, under what conditions you've spent your life. And we know very well that it is also a subject and a role and a function of what kind of class, privilege, or the lack of privilege you've been born into. So I would have wanted to see actually the 70-year starting point reduced, particularly for the working classes, to 60 years, let's say, or even lower. By the time a daily wage worker is 60, his body is much more subject to wear and tear than would have been on a privileged, well-fed,
right.
well-nutritioned, middle class, upper class person.
Okay.
So I think this whole question of age needs to also looked at. Thank you.
Vineet, just one word, which Mr. Chacha has made a very important point. The average life expectancy in India is 70.62 as per the UN data. Just keep this in mind while we do the discussion.
All right, I'll do that. Dr. Rao, how do you take this this new move by the government? This is obviously, as we are also flashing it, is a big game changer. Dr. Rao?
Good evening to all of you, and this is a welcome move. I can say from my own personal experience that when I crossed the age of 60, the company for what we considered the best private insurance company said that we can't continue your insurance, even though I had no claims for nearly 20 years, that because you're now crossed the age of 60. Luckily, around that time, the government came with a ruling that age can't be a limit. So this was at 60 itself. Then what the insurance company started doing was increasing the premium to such a high level that I finally voluntarily quit the health insurance because I had the premium was nearly half the cover amount, and they wouldn't increase the cover amount. So there are problems with the private insurance, and I am very happy that the government has done this. And the other thing I have noticed over the years as a surgeon is that when patients have their own personal insurance, very often they get into all kinds of trouble. Like they may have a 10 lakh cover, but the insurance will, when the bill comes, it may be just 2.5 lakhs or 3 lakhs. The insurance company will say that according to the small print, you are eligible only for 80,000. So these kind of issues need better regulation and more competition also. So group insurance is always far better than this individual insurance. One. Second, as has already been discussed by all my fellow panelists, you see, as you age, actually your needs increase and the health issues increase. The effect of your, if you have had a bad lifestyle, that also keeps increasing with age. And various other age-related illnesses also come into play. So you actually need more cover when you are elderly than when you are young. So these issues, and the other problem is that we are slowly going to become an aging population. The total number of elderly people is increasing. Dr. Kohli said that the average age has already reached beyond 70. It is going to keep increasing. You will have more people in this age group, and many of them will be alone, not by choice, but because their children have gone off elsewhere, because the mobility has increased. Once upon years ago, there was not much mobility, so the children were invariably in the joint family and taking care of the elders. Now the children, first of all, there are fewer children. Those children are not with you. They are either elsewhere in India or abroad. So there are a lot of us elders who are on our own. And if at least the financial aspect of it is taken, it's a great move. The next is, like Mr. Sandeep said, you have to ensure that the public sector, the health sector, improves in its performance. Otherwise, even if you implement this scheme, but the hospitals are unable to manage you, then there is going to be a problem. And I really am I used to be in AIMS, which is a government sector. I am now in the corporate sector hospital, operating there. And I will tell you, it is good if the public sector infrastructure is improved dramatically, because the population is so huge. that the corporate sector will not be able to manage even if you pay the money. We need increased expenditure into health sector, and it should be corruption free, because in a lot of places corruption is worse than cancer. It eats away all the money which is supposed to be invested in improving the infrastructure of the hospital and providing new equipment or repairing old equipment. So all these issues are also important, but I really welcome this idea that the government is going to group insurance.
Dr. Bagai, of course, this takes care of the elderly, but what about the elephant in the room, the rest of the chunk of the people who still grapple to afford healthcare in India? What ought to be done for them?
So the elephant in the room is the smallest age population. 36% of Indian population is in the pediatric age group, 0 to 18. And the Indian demographic profile is dumbbell shaped. So for the next 20 years, India will continue to remain one amongst the youngest population, but with the increasing age expectancy and better healthcare provided to everyone, you will gradually see an aging population. So I think focusing on the larger segment, which is the pediatric age group and the women. So if you include the pediatric age group as a 36% and women from the age group of 18 up to, let's say, 75 or 80, you're looking at about half the Indian population. So what I would really like is a better penetration of the insurance companies cover. We have about 56 or 57 insurance companies in India which are operating. The insurance schemes should be more easily applicable and readable. It's far too complicated even for an educated person to understand the fine print. You get about 200 odd pages which make complete jargon. It's not convenient. It's not user friendly. We need a greater transparency of a link between the TPAs so that the insurance claims don't get rejected or blocked. And very importantly is a healthy mother produces healthy children, produces healthy population, produces a healthy country. We have to look at a good healthcare system for adolescent girls, good childbirth, healthy childbirth, lesser complications, less preterm deliveries, lesser disease burden. Look at lifestyle diseases. A public awareness campaign is the only way forward, and look at hygiene and cleanliness. I think there are many issues which are needed to be tackled. Of course, we need more number of beds and more doctors, but the real tangible ones which we can really address are looking at lifestyle diseases through a wide public campaign to educate people the sins of the big S's, the bad S's, which is salt, sugar, spirit, and sedentary lifestyle. Over to you.
All right, we've almost run out of time. We'll take concluding thoughts from the rest of our panelists as well. Dr. Kohli, same question for you as well. There is a large chunk of the population which is still grappling with, healthcare anomalies. What ought to be done for them?
No, Vineet, Ayushman Bharat is universal. It applies all through the country, as I said, except for the states which are politically, opposed to the scheme or to the center for that matter. It is basically for everyone. But I would like to expand a little bit on the comment I intercepted when I intercepted Dr. Rao, that if 70.62 is the average, let's take 70 years. So we are launching a scheme. Let me play a devil's advocate for a minute. We are launching a scheme which is for 70 plus people. Now, when you say average age is 70, I assume that half the people do not survive beyond 70. I would have been happier if this special scheme for special Ayushman Bharat, over and above an Ayushman Bharat, would have been applicable the moment you attain the age of 60. So that people across the board, all old people, or shall I say, the definition of senior citizen says the moment you hit 60. So the moment you hit seniors 60, I think the scheme should have been applied, ideally speaking. Because if I put it in a lighter way, half the money of the insurance companies is going to save anyway, because half the people are not going to survive beyond 70. So I think the spectrum of the scheme for senior citizens has to be expanded. That would be my closing thought. And of course, the glitches, you can only ask the people who use Ayushman Bharat. I meet a lot of people. I think the glitches have to be removed, because this is one population section which is going to be very vulnerable to those glitches. They are not going to accept, and they will also blow over their top. I'm telling you, if they reach the hospital and they find something like that happening.
Mr. Chachra?
Yes, absolutely. I would argue for the same, that we should start this special scheme at 60. But my second point is the one that I have to reiterate, that the backbone of our health system is our primary healthcare system. We have a huge network, and we saw it during COVID how it struggled, but also how it provided the first course to anybody, rural India and a large part of rural India. And I think that's not, the medical equipments need a lot more upgradation, the worker ratios are low, the doctors' ratios are low. I think a huge amount of attention needs to go, not just in preventive, as I mentioned earlier, but into augmenting, into strengthening, into advancing to global levels, to far ahead of global levels, our primary healthcare infrastructure, which I think would be a crucial game changer as far as health of Indians goes in the years to come. Thank you, Vinitji.
Dr. Rao?
Yeah, I'll just reiterate what all my panelists have said. Actually, they have covered all the aspects. We need this insurance scheme is very welcome. Second, infrastructure has to be improved so that people of all ages do actually receive the both preventive and curative health care. This insurance may just cover part of the financial aspect of it, but the actual delivery of the health care has to be improved, and there should be a way of digitally ensuring that the insurance amount lands up with the patient or their family so that they don't need to run around. So the implementation of the scheme and the implementation of the health care, everything is important. And that is will give the final help to everyone. As we saw in COVID, a lot of things had to be sorted out, and it was done in on an emergency scale. But we need a long-term sorting out of the healthcare issue so that everyone is covered and everyone who is in need is reached out to.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.